Sound check, sound check. Hi folks, Professor Gulliford here. We're going to do a screen share computer sound and optimize the video. And then we'll go to the CDC website for the very latest information on coronavirus. I'm recording this on the 13th of February, and just 2 days ago, this condition, this respiratory disease has been named by the World Health Organization, and that is COVID-19. The coronavirus, obviously very concerning. As of today, 60,000 cases in China, 1,367 deaths. This is the global map, and you can see all the different nations that now have some cases. The United States, I believe, up to 15 of those. But just look at all the nations around the world who are now reporting cases. Almost all of those in people who returned from China. In the United States, these individual states are represented. A lot of testing being done, most of it negative, but 14 positive tests, and I believe there is a 15th today, which has not yet showed up at the website. So let's talk about this condition. Coronavirus exists all the time in various species, not in human beings, but in camels, cattle, cats, bats. There is a snake form of coronavirus, and in those species causes either no disease or a very mild form of disease. That's because those species have good immunological experience dealing with coronaviruses. However, when we see cross-species transmission, what we call spillover in epidemiology, from those species to the human species, nothing good happens. That's because we have no or very little immunological experience with coronavirus. The two previous epidemics you may recall were MERS, Middle Eastern Respiratory Syndrome, and SARS, Sudden Acute Respiratory Syndrome, a few years ago. We seem to be having a similar pattern with this condition, now known as COVID. The source, we believe, originated in a meat market in China. You may have seen the news coverage of that situation. The first cases were animal to human transmission. That's very clear, but there has now been human to human transmission confirmed. Situation in the U.S., obviously the government has taken intensive actions to try to prevent spread here in the United States. Unprecedented steps, including a 14-day isolation period for individuals who enter the United States who've been in China. Illness severity seems to be similar to MERS and SARS, which is very severe with a high mortality rate. Risk assessment, healthcare professionals are asked to be on the lookout for anyone with the symptoms, which are sudden acute respiratory symptoms, very similar to what we saw with SARS. The public health threat is significant. Here in the United States, we're taking every possible step to prevent community-wide spread of coronavirus, and I believe that can be prevented. The CDC has done a lot already. They have, we're expecting more cases, obviously to occur, but there is a test kit. There's a picture of the test kit that you're looking at. It was created very quickly to be able to test effectively for this specific virus, and I do mean the exact genomic background of this virus, not just a coronavirus. Federal government working closely with state, local, and tribal officials. Public health multi-layered approach. Activated Emergency Operations Center. On January 27th, travel guidance recommending travelers avoid all non-essential travel, and that includes all of China at this point. U.S. government taking unprecedented steps, as we mentioned, on February 2nd, suspended entry of foreign nationals who've been in China within the past 14 days, and U.S. citizens may return, but are subject to health monitoring and quarantine for up to 14 days. There is an interim health alert update, which has recently been issued, and also guidance for healthcare professionals and guidance for assessing risk. A lot has been going on. There are teams deployed to the states where there are active cases. The test kit has been produced, emergency use authorization package to the FDA for the test, and the FDA has approved that. The entire genome now exists for this virus. We know exactly genetically what this virus is. And the CDC has now grown the virus in cell culture. You can bet that's a very careful process, but it's essential if we are going to create a vaccine. And of course, that's what the next step would be. It takes months, realistically. Um, I heard an estimate of 6 months to 9 months to create a vaccine. So what can the rest of us do? It's currently flu season, so get a flu vaccine. You don't want to have the flu and then come in contact with someone who is tested positive for COVID. That would be terrible. As a healthcare provider, take care of yourself and look out for cases that need to be tested. If you've had close contact with someone infected, contact your healthcare provider immediately. And for people who are ill, follow CDC guidance on ways to reduce spreading illness to others. The masks that you see everyone wearing are of some benefit. The only truly effective mask is the N95 mask, which is worn in healthcare facilities. It's very difficult for individuals in the community to wear that on an ongoing basis. But the mask, a typical isolation mask does provide some benefit if it's worn correctly. So that's the update. Pretty concerning, of course, but the correct steps are being taken to prevent community-wide spread here in the United States and in other parts of the world as well. Hope that was of some benefit, and we will continue to watch the situation for you.